Now, on to our speaker. We have Barbara Mancini here today. We're very excited. Such a good response to her coming, and so many people who have seen you before, who just loved you. So Barbara, in 2013, unfortunately, was prosecuted on the charge of aiding the attempted suicide of her dying 93-year-old father. She handed him his prescribed morphine 4 days before his death, and the police and hospice workers ignored his written advance directives, and he was hospitalized and treated in defiance of what his end-of-life wishes actually were. So her prosecution lasted a year. It got a lot of attention. You may have seen her on 60 Minutes or heard her on NPR. And ever since then, she's been traveling the country advocating for people being able to make their own end-of-life decisions. So she's going to talk about her legal case today and all the implications that all of us should be aware of for our own end-of-life decisions. And if everybody could just make sure to silence their phones and all their electronic devices, that would be super. There's going to be a Q&A at the end, and then Barbara's going to be joining us for lunch after the talk so we can continue the conversation. There you go.
Okay. Thank you. Thank you for that welcome. Thank you, Kate. I am very honored to be here speaking to Lehigh Valley humanists. I'm going to start by stating the obvious. You are going to die. The people you love and care about will die. Everyone dies. It is a universal experience. Unfortunately, in the United States, we have a lot of difficulty discussing the end of life. Our culture is profoundly disturbed by the concept of death. It's as if acknowledging the reality of death is like an admission of defeat. And that is one reason why only 26% of Americans have completed advance directives. These are the legal documents that have your end-of-life wishes in writing. It is vitally important that people talk openly about their end-of-life values and wishes, put them in writing, and also appoint a healthcare decision maker in the event that you become unable to make your own healthcare decisions. And I will mention that in the last week of life, about 2/3 of people lose their decisional capacity. So it's really important. Well, why is this important? It's because we die differently in the 21st century. Now, in the past, people lived much shorter lives. It's different now. We have medical treatments and technology that allow people to live well into old age, even those who have significant or life-threatening health problems. So now people die older. They die sicker. For most people, their deaths are prolonged. And most people, about 70%, will die in facilities such as hospitals and nursing homes. As the writer Kent Russell observed, history is irony on the move. Turns out that by so bettering and extending our lives, we have re-achieved suffering. And I don't know if any of you heard of Dr. Atul Gawande. He wrote a best-selling book on the end of life called Being Mortal. And he made this observation. The evidence has shown, importantly, that the amount of suffering that people endure in their last year of life is considerable. So we don't like talking about this. And therefore, you may be surprised to learn that there is common agreement among people on how they want their lives to end. People want to die at home, in their familiar surroundings, and in the presence of loved ones. They want their pain and discomfort to be managed. They'd like their spiritual needs, whatever they are, to be respected. And they want to avoid becoming devastating financial or emotional burdens on their loved ones. I also want to share with you some recently published research, and in this study, it was a very large study in which people who were terminally ill were asked how they would define dying well. Well, here's what they found. The overwhelming number of respondents, 94%, listed as their top concern being able to control their own dying process. Well, what does that mean? It means that they want to control when, where, and how they died, and who would be present at their deaths. Then that was followed by being free from pain, then having emotional and spiritual needs met, and then by having a sense that their lives were somehow complete. And that's going to take us into my story. It has to do with my father, his end-of-life wishes, the need for improved care at the end of life, and who gets to decide how you will die. In February 2013, I was arrested in Pottsville, Pennsylvania, and I was charged with aiding the attempted suicide of my dying 93-year-old father. Instead of having the peaceful and dignified death that he hoped and planned for, he died after prolonged suffering and being subjected to exactly the medical treatment that he'd specified in his written advance directives that he never wanted. The circumstances and the politics that allowed this to happen would certainly happen again. And as I tell my story today, you will see that there are forces out there that will prevent you from having your end-of-life wishes honored. There are bigger issues than just one elderly man's tragic end of life. My story is a cautionary tale. This is my dad, Joe Urshaw. He was holding my daughter, Maria. He was one of 12 children born into a family of Eastern European immigrants. He was a decorated World War II veteran. He survived the Battle of the Bulge. And after the war, he worked hard to establish his own business. My dad was a contractor, and he did heavy excavation work. He married my mom, and together they raised 4 children. My dad had many talents, and among them were that he could build anything and he could fix anything. My mother will often say that she never had to call a repair person for any reason until the last year of my father's life. So I'm going to take a few seconds to brag here a bit. My mom and dad had a second home in Florida, and Dad rebuilt the deck around this pool by himself when he was 79 years old. And that driveway had been dirt and gravel. Well, he dug it out by hand, and he poured that cement driveway by himself when he was 80 years old. Gives you an idea of the type of person he was. He was fiercely independent, strong-willed, and he had very focused convictions about how he wanted to live. And that probably describes everybody in here today. He had a number of health problems. He had diabetes, high blood pressure, heart disease, kidney disease, and he'd even had a stroke at one time, but he recovered from that. And at the age of 92, my dad made the decision to stop taking all the medicines that treated those health conditions. Why? They weren't helping the quality of his life, which was getting worse and worse. He was no longer able to do the things that gave his life meaning. Well, he discussed his feelings with my family and with his doctor, and with the full knowledge that this decision would likely shorten his life, all of us agreed to respect his values and his wishes. Now, before February 2013, I was just a regular person, living a life of relative obscurity. I've been married for 22 years. We have 2 daughters in college. I live in Philadelphia, and I worked in a Philadelphia hospital as an ER nurse. My family lives in Pottsville, which is in Schuylkill County, Pennsylvania. It's very close with my family, very involved with them. We spoke on the phone every day, and I visited frequently. By the age of 93, my dad was terminally ill. He enrolled in home hospice care, and he was having significant pain. As a nurse, I know that pain and other distressing symptoms often worsen as a person nears death. My father asked me to hand him his pain medicine. It was a partly filled 1-ounce vial of liquid morphine. He always opened that childproof cap that Mom and I both struggled with, and Mom would measure out the dose. I did the same routine with him that day. Before I could measure out the dose, he quickly took what was left in that vial. I know he was having significant pain. He had fallen the day before, and the previous night was the worst one he'd ever had. As my mother and brother attempted to slowly take a loose button-down shirt off his shoulders, he cried out that it felt like they were breaking his bones. Whether his intention that day was to do anything other than relieve his pain, he didn't say. Hours later, a home hospice nurse arrived, and I told her Dad took the morphine. I didn't think I had anything to hide. He was drowsy, but he was not unconscious. He was breathing normally. He was able to follow commands, and he could respond to questions. The hospice nurse and her supervisor insisted that my father be taken to the hospital to be treated for an overdose. Now, my father had written advance directives that clearly stated he wanted no life-prolonging treatment. I was his legal healthcare proxy or decision maker. He had a standing do not resuscitate order, and he was adamant that he never wanted to go to a hospital, and that was recorded in his hospice record. I tried in vain to ensure that my father's wishes were respected. But the hospice called 911. Police and then paramedics arrived. And by police order, my father was removed from his bed and taken to the hospital for treatment. Ironically, when the paramedics asked my father if he was having any pain, for the first time, his answer was no. I was arrested then and there right in the house. I was charged with aiding an attempted suicide. In Pennsylvania, this is a second-degree felony, and conviction will get you 10 years in prison. The police captain who arrested me told me I no longer had any say in what happened to my father. My mom had gone to the ER to be with my father, and the hospital asked her to give her consent for them to treat my father, because at this point, they no longer considered him capable of making his own healthcare decisions. Well, the police informed my mother that if my father died, things would go much worse for me. My elderly mother was placed in the agonizing position of having to choose between honoring her promise to my father, whom she loved and was married to for 62 years, or helping me, her daughter. Now imagine being put in that position. She knew no matter what decision she made that day, that she would hurt someone that she loved very much. Well, she felt like she had no choice, so my mother gave her consent for the hospital to treat my dad. Another 2 hours passed, and Dad was more drowsy, but he was still breathing normally, and the hospital gave him Narcan to reverse the effects of the morphine. He was livid that he'd been brought to the hospital, and he knew that I was in trouble. He shouted and pleaded over and over, "Don't hurt Barbara. Don't let them hurt Barbara." My dad suffered tremendously, not only from the unwanted medical treatment that he received, but also from the anguish of knowing that I was being accused of helping him end his life. He died 4 days later from pneumonia, not from a morphine overdose. The Pennsylvania Attorney General's office then began a year-long prosecution of me. Now, if you're wondering why the Attorney General got involved, it's because the Schuylkill County District Attorney had been a friend of my younger sister's since high school. It was an election year. She was running for election, and she wanted nothing to do with the case. So she handed it up to the Attorney General's office, and they pursued it aggressively. I was placed on unpaid leave from my job. The prosecution had the court put a gag order on me, so I could not speak publicly about my case, nor could I refute any of the misinformation that was out there. And I incurred over $100,000 in legal fees. Now, my case received widespread media coverage. I know it got a lot of it up here in Allentown. It actually became national and global news. I read about myself in media outlets from every continent except Antarctica. The reaction was outrage. And it wasn't directed at me. It was directed at the hospice, the police, and the prosecution. Of the many opinion pieces and editorials that were written about my case, not one supported the decision to prosecute. That's unheard of in a criminal case. Well, it created a lot of sympathy for my father and for me, but it also created a lot of fear among the dying and their caregivers, who were now petrified that the same thing would happen to them too. Exactly 1 year after my father's death, a Schuylkill County judge ruled that the case had no merit, and she dismissed the charge against me in a scathing 46-page ruling. The Harrisburg Patriot News wrote this in an editorial about the dismissal. It was a miscarriage of justice from the day charges were filed. We received no apology from either the hospice or the prosecution, and we were left to pick up the pieces of our lives. There were a number of elements that created this horrific ordeal for my father and me. I'm going to discuss the major ones. The first was failure of Hospice of Central Pennsylvania. Now, you may be aware that hospice is a model of care that's based on the philosophy that each of us has the right to die pain-free and with dignity, and our families will receive the necessary support to allow us to do so. I fully support good quality hospice care. We had relatives in our family who had used hospice in the past, and they had wonderful experiences. I expected no less from my father, but what he got was something very different. My dad was in home hospice care for 2 weeks with no medicine for pain. I called the hospice and I asked them to prescribe morphine, which is reasonable and appropriate. Morphine is the most commonly used medicine to treat end-of-life pain, by far. Well, the prosecution used that phone call as evidence against me. They claimed that it showed that I was intending to help my father end his life. I didn't know at the time that I made that call but morphine had indeed been prescribed for my father 2 weeks earlier, and the hospice withheld it. They later testified that they did that because my father said he didn't want to take any medicine. Now, I will agree. He did not want to take any medicine if he thought it would prolong his life. But he was self-medicating at home with lots of Tylenol and ibuprofen to treat his end-of-life pain. The hospice used this phrase frequently in their documentation about my father. Comfortable despite pain. What do you think of that? Well, I was astonished when I read that in my father's hospice records. I mean, it's certainly an oxymoron. And I will tell you that my family and I vigorously dispute their characterization of how my father felt. In court, my defense attorney asked the hospice team leader, who is a supervisor of the members of the hospice team, he asked her if my father had the right to have as much medicine as he needed to relieve his pain. And this was her response. That's not a stated right. This same supervisor also testified that my father should not receive any more than a very low dose of morphine, 2.5 milligrams, at any given time. This attitude guaranteed that my father would suffer until the very end. And guess what? It defies what the United States Supreme Court ruled in 1997 in these landmark cases, the Glucksberg and the Quill cases. The majority opinion ruled in both these cases that terminally ill patients have the right to as much medicine as they need to relieve their pain, even if it advances the time of death. This is settled constitutional law for 20 years. Lesson learned. Not all hospices provide good end-of-life care, and not all hospices agree with or honor the decision of the United States Supreme Court. The second element of this ordeal is the law. The Pennsylvania statute that criminalizes aiding a suicide is vaguely written, as is New Jersey's. Do we have any New Jersey people here? Few. And all the other states that have these criminal laws on the books. None of them specify what actions rise to the level of aiding or assisting in a suicide. And I want to mention here, too, that it is not a crime anywhere in the United States for people to end their own lives. A lot of people don't know that. But it is a crime in most states for people to aid in a suicide. But they're vaguely worded statutes. And the problem with vaguely worded criminal laws is that they are then left open to broad interpretation. The prosecution, in my case, interpreted the law to mean that providing a dying man his legally prescribed medicine, which he was permitted not only by law, but by physician order to self-administer, rose to what they claimed was the felony level of aiding a suicide attempt. So, caregivers have to fear arrest and prosecution for advocating for their dying loved ones, and the dying have to fear having unwanted medical treatment forced upon them because someone in a position of power decides that their wishes will not be honored, either because they don't agree with that person's wishes or because they feel it's their right to enforce their or impose their beliefs on other people. In fact, 1 out of every 4 Americans has experienced unwanted or excessive medical treatment. And this equates to tens of millions of Americans. Now, certainly, people bear some responsibility if they have not articulated their end-of-life wishes. But for someone like my father, who not only openly spoke about his wishes, but had them documented in legal papers, to have them overridden is unconscionable. I hate to tell you this, but it happens a lot more commonly than you believe. So I'll tell you some of what my father's last days were like. In the ER, he was frantic and distraught about my arrest. He pulled out his IV, pulled off the heart monitor, and tried to get off the stretcher. Well, he was admitted to the hospital, and we all know what that means. Lots of needle sticks for blood tests and IVs. He had a urinary catheter inserted. His hands were restrained. His kidneys were failing. And because his kidneys were failing, the potassium level in his body became dangerously high. He was not on kidney dialysis, so the next best treatment option to treat this high potassium was to give him a medicine called Kexalate, which lowers the potassium level in the body by causing massive diarrhea. Well, it worked as intended. The profuse diarrhea then led to the loss of the top layer of his skin, front and back, everywhere that diarrhea touched. His skin was open and raw and red. At that point, he no longer spoke, but he moaned. His chest X-ray showed pneumonia in both lungs. His failing heart could no longer handle the IV fluid he was being given, and he developed such massive fluid accumulation in both of his arms that they became unrecognizable. They looked like balloons that were ready to burst. And finally, on the day he died, my father was given morphine to ease his discomfort. The third element of this ordeal is criminal justice in the United States. Did you know this? Yes. The United States has the largest prison population in the world. Roughly 1 out of every 107 American adults is behind bars. I don't even know the stats for juveniles. And if you factor in the number of people who are on parole or probation, that number rises to 1 in 36. How did we get there? Well, there are a number of reasons for that, but one of the major ones is that prosecutors use their enormous power to pressure people who have been charged with crimes into plea bargains. Plea bargains count as convictions. And that's how prosecutors get their 94 to 98% conviction rates. Those are not won at trial. Those are the result of plea bargains. And in fact, most people who are charged with crimes do indeed agree to plea bargains, because the consequences of possibly losing at trial are so dire. Prosecutors will insist on much harsher sentences for people who exercise their constitutional right to their day in court. Well, I also was placed under tremendous pressure to waive or forgo my preliminary hearing and work out a plea bargain. I refused to do it, but I certainly had some advantages that many people who are charged with crimes don't have. I had my own defense counsel. I'm white. I'm middle class. I'm educated. I had a lot of support. After my preliminary hearing, I filed a petition for habeas corpus, which is a motion to dismiss the charge against me. And we had a court hearing on that motion. And I can tell you, it was quite a drama that day in that Schuylkill County courtroom when my attorney pulled the page out of the hospice record and held it up in court, the page that showed that my father had actually been prescribed a much larger dose of morphine 2 weeks before I ever made a phone call about it. The prosecutor, who is a senior deputy attorney general, a career prosecutor with decades of experience, had to admit in open public court that he had never read the hospice record. He also had to admit to the judge that this evidence was completely inconsistent with the testimony of the hospice witnesses. Now, why would a prosecutor not even read their own evidence, which they had in their possession from the beginning, and I only received it in discovery after my preliminary hearing? Why wouldn't they read their own evidence? Well, they fully expected that I would succumb to that pressure to plea bargain, and apparently it just wasn't worth the time to verify their own witnesses' statements. I can't make this up. The fourth element of this prosecution, or this ordeal, is politics. There was one more person who wanted this case prosecuted, and that was the Schuylkill County coroner, David Moylan. Now, a little background here. Death investigations in the United States are not done in any standardized or consistent manner. Every state does it differently. So some states, like New Jersey, have a medical examiner system, and medical examiners are usually trained pathologists. Some states have coroner systems, and states like Pennsylvania, a mixed medical examiner and coroner system. So the large urban areas like Philadelphia and Pittsburgh have medical examiners. The counties have coroners who are elected. In Pennsylvania, anyone want to guess what qualifications you have to get on the ballot to run for coroner? Well, that's close. Kate said none, but that's very close. You have to be a legal adult, you have to be a citizen of the United States, and you have to be a resident of the county in which you're running for at least a year. That's it. The coroner system is an anachronism that predates the Magna Carta. Does anybody remember when the Magna Carta was signed? The year 1215? It functions so poorly that the National Academy of Sciences has been calling for the abolishment of the coroner system repeatedly since 1928. But that's what we have. And Coroner David Moylan happens to be more qualified than most. He's actually a physician. He's a radiation oncologist, not a pathologist. He treats cancer patients. So Coroner Moylan made the determination that my father died from a morphine overdose. And he ruled that my father's death was a homicide. Yes, a homicide. Now, I knew that my father died from pneumonia, among his other terminal conditions, but I had independent experts, including a forensic toxicologist, look at his records for an objective evaluation. And they all agreed. He did not die of a morphine overdose. And I will quote the toxicologist, this was not a lethal level of morphine by any means. Now, why would the coroner say such a thing? A few weeks after releasing my father's death certificate, Coroner Moylan publicly announced that he was running for United States Congress on a sanctity of life platform. He was asked in an interview what made him decide to run for Congress, and this was his response. It really just boiled down to one primary issue, and it's one I feel strongly about: the sanctity of human life. It's so important to defend human life from conception to natural death. He also said this: it's very important that every decision you make as coroner to determine the cause and manner of death, see how does it affect the sanctity of life. I've been doing that for the last year and a half. I'll also tell you that I believe it was on a Scranton news program. He said that if elected to Congress, His first week in office, he would introduce a human life amendment to the Constitution. Now, the coroner has every right to his religious beliefs in this country. He's an openly devout Catholic. He has every right to be politically ambitious. What do you think happens to the integrity of death investigations once religion and politics are injected? Everyone in this room is well aware of what the implications were for me if a judge or jury had believed what this coroner said. Now, interestingly, even the prosecution that was pursuing this aggressively kept the coroner at arm's length. And they even wrote in a brief to the judge that they never argued that I was responsible for my father's death. And, by the way, he did not get elected to Congress. So, to recap, these 4 things: failure of hospice of Central Pennsylvania, a vaguely written criminal law, criminal injustice in the United States, and politics all came together and created this horrific ordeal for my father and me. Do you think this could happen again? In our polarized political situation in this country? Well, here's what the Attorney General of Pennsylvania had to say when the judge dismissed my case. If the citizens of the Commonwealth disagree with an existing statute, it is incumbent upon the people to work with the General Assembly to amend the law. Until such amendment occurs, it is the legal responsibility of prosecutors to enforce the law as it currently exists. And I might add, however they choose to interpret those vaguely worded laws. Now, I'm in Allentown, and you guys probably know who Paul Carpenter is. He's an opinion writer for the Allentown Morning Call. He wrote a number of columns about my case. And this was his reaction to Attorney General Kane's statement. If medical people can ignore a do not resuscitate stipulation, a living will, or any other obstacle to the profits of prolonged agony, and if Pennsylvania's top law enforcement officer sides with them by going after someone who tried to protect a family member's dignity, it's a frightening threat to individual freedom, indeed. Well, during the year that I was out of work, I spent a lot of my time doing my own research. I researched hospice care, pain management at the end of life, researched the law, and I researched the Oregon Death with Dignity Act. 20 years ago, Oregon became the first state in the country to enact medical aid in dying, whereby a terminally ill person who meets the eligibility requirements can obtain a prescription to bring about a peaceful death. Well, here's what I found out. Full third of the people who receive the prescription never even use it. But they are comforted by knowing they have it in case they feel their suffering becomes unbearable. Many of them will say that having that prescription allows them to spend their remaining days living. Well, I was curious to see what effect medical aid in dying had on the provision or the quality of end-of-life care in the states where it is legal. And I found out this. Now, Oregon already was known for providing high-quality hospice care, but they honor advance directives. They're among the states with the most number of people who die in their own homes and the least who die in facilities like hospitals or nursing homes. Having aid in dying has increased training for physicians in palliative and hospice care. It has increased access to hospice care. And even opponents of the law widely agree that having that law on the books has facilitated those very often difficult conversations that we all need to have about the end of life. There has been no instance of abuse misuse or coercion in the carrying out of this law. No vulnerable populations have been targeted. And by vulnerable, I mean the elderly, the disabled, the poor, poorly educated, minority populations, people with mental health issues. None of those have been targeted by the law. In fact, the ones that access the law most frequently are people who are middle income or higher. They're pretty well educated. Almost all of them have insurance. Vast majority are white. Overwhelming majority are people who have cancer. The law has worked so well that even bioethicist Arthur Caplan had this to say. The Oregon law has benefited many more people than have actually used the law. Well, currently in the United States, there are 5 states in which medical aid in dying is legal. It's Washington State, Oregon, California, Vermont, and Montana through court order. In a nutshell, medical aid in dying requires you to be terminally ill, which means you have to have 6 months or less to live, as determined by 2 independent physicians. You have to be mentally capable of making your own healthcare decisions. Now, sometimes people bring up the issue of dementia or Alzheimer's. People who are in early stage dementia or Alzheimer's who are still capable of making and understanding their healthcare decisions do qualify for the law. But once they lose decisional capacity, they're no longer eligible. A person has to be able to self-administer the prescription. So this distinguishes it from euthanasia, where a drug is given to someone. The involvement of physicians in this is determining the eligibility and writing the prescription. And thereafter, it's up to the person whether or not to take it. And then they have to be a legal adult in the United States. Now, perhaps you're wondering, how many people favor aid in dying? Show you some of the polling. People overwhelmingly in the United States support medical aid in dying. Gallup poll, 68% support medical aid in dying. The Harris poll, 74% support aid in dying. And a Medscape poll of physicians in 2014 show that now a clear majority of physicians support medical aid in dying. I'm going to share with you New York's polling, because this was done late 2015. 77% of New York residents support medical aid in dying. And after learning more about the legislation, including arguments from opponents, support rose to 81%. Now, if you look at social policy issues, those polling numbers are in the stratosphere. And yet it's very difficult to enact this legislation. And that's because there is strident opposition from certain groups. Most physician medical societies oppose medical aid in dying, although before California passed their law, the California Medical Society removed their opposition to aid in dying and became neutral. And in the state of Colorado, the Colorado Medical Society just removed their opposition. So they're not saying they support it, they're just no longer opposing it. It is opposed by most religious leaders and most religious doctrine. However, and this surprised me when I learned this polling out of the polling out of New York State, 74% of Catholics support medical aid in dying. 74% of Protestants support medical aid in dying. 83% of Jewish voters support medical aid in dying. The leaders don't, but the believers, most of them do. In fact, the only subgroup that was adamantly opposed were faith believers who attended religious services more than once a week. That's a very, very small subgroup. But they're very vocal in their opposition. And there's opposition from some disability rights groups. Although I will tell you that the polling shows that the disabled population supports medical aid in dying at the same levels of the non-disabled population. So 3 points I'd like you to take away from this today. End-of-life care should align with a person's values, preferences, and wishes. All good health care should align with that. Second point, an ordeal like this certainly could happen again. And third, medical aid in dying and the benefits that this option brings should be a choice available in all 50 states plus the District of Columbia. Last year, Stanford University did a large study where they looked at different cultural groups within the United States, and they asked them what kind of care they wanted at the end of life. So these groups included multi-ethnic groups, multilingual groups, and they were all around the San Francisco area. And this is what they found. People want to live as long as they have a good quality of life. Well, who gets to determine what your quality of life should be? It should be you. It shouldn't be a hospital official or a government official or the police or your doctor or your relative. It should be you should be able to determine what a quality of life is. And they found that when it is their time, the respondents to this research study said that they want to be consulted so that they die in a way that their wishes are respected. And didn't we hear this over and over again in the research? This is an intensely personal issue. And your choices at the end of life should not be restricted because of theological doctrine or someone else's personal ideologies. The means to end suffering, whether it's through high-quality hospice care, medical aid in dying, or both, should be available to those who want it. When you think about it, most of us have control over the major decisions of our lives, except for how we get to die. So it brings us back to this. Who gets to decide how you will die? It was very important to my father to be able to make his own decisions about his life, about his health care, and about the end of his life. He took the necessary steps to ensure that that would happen. And yet, he had a terrible death. And I can tell you that my family and I continue to be haunted every day by this horrific ordeal that was his end of life. So what can you do? Well, actually, you can do a lot. I think the first priority for everybody should be to have those very important end-of-life discussions about your values, preferences, and wishes. And you should find out what your loved ones want. Get it in writing and appoint a healthcare decision maker. Yes, my father did all that and look what happened. But this is still your best assurance that your end-of-life wishes will be honored. What else can you do? If you or a loved one needs hospice care, choose a hospice carefully. Never in my wildest imaginations did I think that a hospice would not do what they were supposed to do. I naively assumed that once my father enrolled, they would provide the proper care. So it's really important that if you or a loved one needs hospice care, that you interview them before you make a choice. Now, that's difficult if people live in sparsely populated rural areas. It's not an issue here. You have a choice of a number of hospices. And there are certain questions you should be asking. We can go over that in the Q&A if you want more specifics about that. But you definitely want to make sure that they align or they will honor your loved one's values and wishes. What else can you do? You can get involved. I am working with Compassion and Choices. It's an end-of-life advocacy and service organization, and I have their literature in the back there, which I hope you'll take. They have a number of volunteer opportunities through different states. If you want to, table at events or get petitions signed, you can go on their website and look at that. Compassion and Choices was instrumental in helping to pass aid in dying in the states where it's now legal. And they have what they're called volunteer action teams. And I can tell you that those volunteer action teams, the grassroots support, is really what moves the legislation through all these states. You saw the polling numbers. They're really high. And yet it's very difficult to pass this legislation. What usually happens in most states is that when the legislation is introduced, it doesn't even come up for a committee hearing. So committees are chaired by who's ever in the majority party, whatever state you're in, and in Pennsylvania, it's the Republican Party. And no Republican committee chairs have ever brought the introduced legislation up for a hearing. So then it goes through the legislative session, and this is not a pun on words, but it dies at the end of the session. And then it has to be reintroduced the next one. So that's what usually happens with most of the legislation. And feeding into that, contact your state legislators. This legislation is passed at the state level. It's not federal legislation. So it's really important that people contact their legislators. They do pay attention to phone calls, emails, written letters, or when you show up at a person's office. Now, I'm going to give you some details about Pennsylvania. For several years now, we've had aid in dying legislation introduced, but it doesn't even get a committee hearing. In the Pennsylvania House, it was introduced by Representative Mark Rossi from Berks County, and he had a number of co-sponsors. As you can see, most of those co-sponsors of the legislation were in southeastern Pennsylvania. Pennsylvania Senate, Lisa Boscola, from this area, did co-sponsor the Death with Dignity bill. We need to have a lot more co-sponsors from other parts of the state for this to ever happen. So how are those legislators that you elect going to know that you support this? You have to call, write, email, or visit in person. And I'm going to give you some examples of how this works. Last year, I went to Dover, Delaware, and I testified for a committee hearing on an aid in dying legislation that was introduced. They don't really have much of a grassroots support network developed yet in Delaware, but the legislation came up for a hearing, and one of the committee members pulled up a sheaf of papers, emails, and he said, I have 50 emails here from people who oppose this legislation, and not one in support of it. How do you expect me to vote for it? Well, I can't argue with that. They need to hear from supporters as well as opponents. And here's another example. The state of Massachusetts, which is much farther along in moving their aid in dying legislation, that piece of legislation was introduced by Representative Louis Kafka because one of his constituents came to his office and asked him to do it. So it really does matter that you contact your elected senators, state senators, and representatives. And all you have to do to find out who they are is go to the Pennsylvania website to see who the representative and senator is for your district. And going along with that, it is important to vote in every election. In 2010 was the year that the census was taken, and that was the year that in Pennsylvania the Republicans were made in the majority. That was an off year. It wasn't a presidential year for an election. It's important to vote in the off-year elections, too. Because whoever controls Harrisburg will control what bills get brought up to committees for hearing. And they have to pass through the committees first before they ever go for a full vote in the House or the floor. For you New Jersey folks, New Jersey's much farther along in their legislation. The prime sponsor was Assemblyman John Bersicelli. Now, it has been reintroduced in the current session of the New Jersey legislature, and there are enough votes to get it through the committee in the Assembly. But the Senate is still a problem in New Jersey, especially in South Jersey. So it's really, really important for people to contact those legislators. And I just put a couple recommended readings up here on the screen. Being Mortal by Atul Gawande. I mentioned it at the beginning. and Knocking on Heaven's Door by Katie Butler. These are both very moving books that will definitely get you thinking about end-of-life issues. So I highly recommend them. And for those who have any interest on death investigations in the United States, there's a very, very well done Frontline and NPR production about that. And you can just watch that on the web if you type that in. So I'm going to close my prepared remarks here just by saying the reason I'm here today is I don't want what happened to my father and me to ever happen to someone else. And I hope that by hearing my story today, you will be inspired to have those end-of-life conversations and hopefully to get involved in some way to help make some changes that we desperately need in end-of-life care legislation and the laws. I want to thank all of you who came here today to listen to this story, and I will be very happy to take your questions. Thank you.
Thank you so much, Barbara. I have one comment here in that we all honor using this microphone for the sake of the video that's going to be made. So who has a question for Barbara?
Thank you. I was very interested in what you said about the morphine because I have been through taking care of someone who was dying, and I never really even knew the hospice thing that you could get to look at to see what medications and how much they can get. Because I did the same thing you did with the morphine. My husband was a physician. He had Lou Gehrig's disease, ALS, and he was completely paralyzed. And he did have the liquid morphine. They said to give him so many drops and all that. Whereas he did ask me to give him more, and I did. So I was at a risk of what happened to you happening to me, only that he told me never call 911. Because even though he had advanced directive and he was dying, he could not move or speak or anything, he said never call 911 because they're obligated to try to resuscitate you or try to get you better and take you to the hospital. So I don't know if they make that a point in hospice to tell you that, or am I supposed to know that? I would never have known it unless he told me.
Well, you're pointing out some very good things. First of all, most hospice care is done in people's homes. There's a small percentage that receive it in facilities, but the vast majority of people who receive hospice care, it's in their own homes. And hospice doesn't do the actual caregiving. They are a support service. So they come by maybe once or twice a week or more if there's an acute need. And they're supposed to provide the things that make the person comfortable. They have social workers, spiritual counselors, if people want that kind of thing. But hospice care is supposed to educate hospice providers, the caregivers and the person receiving the hospice care. It's a team effort. So what you're talking about here, there's a very good example of where they fell short because you're supposed to know what's available. They're supposed to instruct you on how you're supposed to proceed with a lot of these things. And I can tell you in my father's case, we never knew there was a whole list of medications ordered for him. We didn't know they were even ordered. No. And it just kind of blew me away the way this whole thing worked out. I will tell you that many times when I do these presentations, there will be people who raise their hand and say, we had wonderful experiences with hospice. And lots of people do.
I thought I did.
But lots of people also raise their hand and say they had terrible experiences. No one is gathering data about that. There is no public information available to anyone, consumers or physicians, about the quality of hospice providers. It doesn't exist. They're in the process of trying to create that kind of a database, but that information won't be available until 2017 at the earliest. So how do you know which hospice to choose? You have no information to go on unless you know someone who used one and had either a good or bad experience. Now that is very different if you look at data on hospitals and nursing homes and home health agencies. There's government data about that. Whether it's accurate or good or not, there at least is some base of data for people to compare quality between institutions. But it doesn't exist for hospice companies. So that's a problem, which is why people need to do their research. And, I can stand here and say that if you have someone who's dying, you're very vulnerable. You're in crisis mode. How many people are going to go to their computer and spend hours doing research? I didn't do it. I've done it since then, but I didn't do it beforehand. I mean, you're lucky you're getting through the day with your sanity intact. You're stressed out. So this is why it's really important to look into this ahead of time. And this isn't relating to your question, but I do want to mention or ask all of you, do you know at what age you should have an advance directive completed? 18. Probably a lot of you are like, what? 18. Well, why is that? Because that's when you're a legal adult. Does anybody remember Karen Ann Quinlan, Nancy Cruzan, and Terry Schiavo? All healthy young adults who had tragic events befall them, and they didn't have anything written down about their end-of-life wishes. And they became the most notorious cases in the United States on the right to die and who gets to make decisions about someone. So at 18, you may not be deciding about a feeding tube or a ventilator. You just have to appoint a healthcare decision maker. If for some reason you have a head trauma or some other tragic thing happen and you can't make your own decisions, you have to have someone who can legally make them for you without some court or institution stepping in and saying that they have a say in that person's end of life.
Yes, is it true about that? Like, if you have an advance directive, and if you call 911, they can completely ignore that. And once you get on a machine and you're in the hospital, my husband told me how hard it is to get somebody off that machine.
Yeah, the question is about the paramedic issue. If 911's called, you no longer have control of that situation. Now, there are paramedics that will honor directives if they see them.
They're not obligated, though.
They're not obligated. No, they're not. In fact, even physicians are not obligated to honor them if it goes against their moral convictions. But I will tell you this, research from emergency physicians, overwhelming number of them greatly favor having advance directives. Someone gets wheeled into the ER, physicians never met them before. If there's no directive at all, everything's going to be done. So ER physicians love having advance directives because it gives them some idea of how to proceed. Now, another thing I will mention that is if you have an advance directive, please do not keep it locked in the safe. They have to be easily accessible. So your physician, your healthcare provider should have a copy. Your inner circle, the people who matter to you should all have a copy of this, and certainly your healthcare proxy should have a copy. And if you're someone who's got significant health problems, put it on the refrigerator. Because the refrigerator is the first place that medics will look for medicine lists and for directives. So if you travel out of state, it's very good to have a copy that is notarized. Now, you don't have to have notarized copies in Pennsylvania, but if you're out of state, many other states will not honor an advance directive unless it's notarized. So that's a problem that people have.
I see Ruth with her hand up. I'll pass this back to her.
One quick question and then a more detailed one. Are hospices both profit and nonprofit?
The vast majority of hospice providers now are profit.
Okay, that explains a lot.
They overwhelm the market, yes.
That explains. All right, my question to you is, you said that your father had all this medication prescribed to him, but hospice, who was prescribing the medication? I thought hospice did that.
He had a primary care physician, and the one that was assigned to him he had actually never met because his previous one had retired. He stopped going to the doctor. He was assigned another primary care physician. And the day he needed to enroll, there was no physician appointment available, so he saw a physician assistant who then contacted the main physician, and that physician wrote the hospice orders the day he was enrolled. So it was the primary care physician. They're supposed to work collaboratively. Hospice physicians and primary care providers are all supposed to work collaboratively to ensure that the person who's dying is comfortable and has the care they need. It didn't happen in this case.
So hospice does have physicians that are able
Oh, yes,
to
they do.
prescribe. Okay.
They have physicians on staff, and they have medical directors. And they all fell short in my dad's case.
We have time for one or two more. Laura? Barb?
Okay, my question is about the coroner and his coroner diagnosis that your father died of a morphine overdose. He had been given the Narcan, so he was free of the morphine until the hospital gave him a dose of morphine.
Correct.
So if that's what he felt, why wasn't the hospital indicted?
It's interesting because several of the many articles that were written about my case did point that out. I was not the last person who did that. He received intravenous morphine in the hospital. Well, I don't think facts mattered at all to the coroner. He did not do any fact-based findings here. Or his opinions were biased. Yes, he's still coroner. He did not, and I have to tell you this, bias pervades lots and lots of areas of forensics. I mean, we all like to think it's like CSI on TV, sparkling clean labs and everybody's up on the latest technology. The reality is far, far different from that. And it doesn't only have to do with death investigations. It has to do with every area of forensics. And this has been getting a lot of attention recently. Whether lawmakers care about that is another issue. But, the FBI in the last 2 years totally discounted bite mark evidence. I mean, people were convicted and sentenced to die on that kind of stuff in the past. It's now been shown to be junk science. A lot of fire science has been shown to be junk forensic science. So, it isn't only in death investigations, but the forensic toxicologist that I enlisted to look at my father's records told me that coroners are wrong 25% of the time. I was stunned when he said that. That's a huge number of cases. When you think of the high stakes of death investigations when they're related to criminal cases, to have a quarter of them wrong. And again, I'm well aware that I had many advantages that a lot of people wouldn't have, that I could question it. I knew my father didn't die of a morphine overdose. When he was shouting at everyone, he was not going to die of a morphine overdose. So, yeah, I certainly think that bias entered the whole way this case was investigated. There's no doubt about that.
Last question for Barb.
I'm just curious about the fact that you were relieved from your job. Was that something that was? I don't really understand why that would be the case. What caused that?
Well, my attorney told me that with healthcare professionals and teachers, their employers, their first priority is the population under their care. So, look, I was charged with a felony. He told me to expect that I would lose my job, and I did. And I understood why. It was still difficult. As soon as my case was dismissed, they immediately offered my job back. I didn't return immediately because I couldn't walk in the door without breaking down. I had to go into counseling. But I did return to my job, and I stayed at it for 8 more months. And then I left because I started doing speaking circuit, and I couldn't do both. So, oh no, it's the opposite. I mean, look in the newspaper. Anybody who's arrested, and you hear any information about that, do you think they're innocent until proven guilty? No, it's the opposite. I know that's what our same like liberty and justice for all. We like to believe that, but that's not the reality here.
Thank you so much, Barbara.